This work presents a multifunctional magnetic milli-spinner robot, enabling a range of robotic endovascular interventions and addressing critical challenges in endovascular surgeries. State-of-the-art endovascular disease treatment leverages imaging methods to navigate hollow tubes called catheters to the lesion. Then, small devices or therapeutic agents are employed. However, catheters suffer from difficult and unreliable navigation in narrow, winding vessels, such as the cerebral arteries in the brain. To address these challenges, the magnetic milli-spinner is designed to navigate through the tortuous vasculature, capable of performing various operations such as mechanical thrombectomy, targeted drug delivery, and aneurysm treatment. The milli-spinner is designed from a cylindrical structure with features of 3 helical fins and attached magnets. Important modifications of a through hole and helical slits are integrated to regulate flow around the milli-spinner, facilitating the fastest ever swimming of untethered magnetic robots in tubular environments. The propeller-like structure of the milli-spinner allows for propulsion by its spinning motion under magnetic actuation. Here, we demonstrate the magnetic milli-spinner navigating in a true-to-size human cerebral artery flow model. Aligning with the rotating magnetic field's axis, the magnetic milli-spinner agilely steers and moves along the intricate and convoluted pathway and returns back. Here, the magnetic milli-spinner is demonstrated to swim forward inside a porcine carotid artery. The milli-spinner shows promise as a device for performing rapid and effective clot removal. The milli-spinner mechanical thrombectomy fundamentally differs from existing technologies, which can break clots into pieces and cause distal emboli. Instead, the magnetic milli-spinner generates a suction flow to press the clot against the milli-spinner, and the clot is sheared by the spinning motion. The coupled loadings directly densify the fibrin network and expel red blood cells from the clot, enabling around 95% clot volume reduction. The scanning electron microscopy images provide a detailed view of the clot microstructure before and after treatment. Aside from thrombectomy, the milli-spinner can deliver drugs to targeted regions to supply localized medicine. In this demonstration, blue powder is loaded and sealed into the milli-spinner as a drug model. With a spinning motion, the milli-spinner gradually releases the drug as it moves back and forth. With its delivery capability, the magnetic milli-spinner is demonstrated to be an innovative approach to aneurysm treatment with the loaded coagulant agent. This method reduces or prevents blood flow into the weakened area through in situ clotting by the milli-spinner. The procedure begins with the identification of the aneurysm location by injecting contrast dye. Once the aneurysm is identified, the milli-spinner is introduced and swims through the tortuous and distal vessels to reach the aneurysm site for embolization. Post-treatment imaging shows that the aneurysm is successfully filled, with no contrast dye entering the aneurysm, confirming effective embolization. We envision the developed magnetic milli-spinner would lead to more widespread availability of robotic endovascular treatments, improving outcomes for patients facing a variety of endovascular conditions.